friends, I am Akansha Kumar from iOnline Doctor. Diabetes nowadays is rampant in all age groups, especially in our country. People now and then have questions and queries related to the disease. Fortunately, we have Dr. Jignesh Rathod to help us solve a few of them. Doctor, tell me that how I as an individual get signs or symptoms that I am suffering from diabetes.
Okay, so if you have symptoms like increased frequency of urine or increased thirst or increased appetite, and you have significant weight loss in few months instead of good appetite, men are very prone to diabetes than female, especially when they have obesity, especially when they have a very stressful lifestyle, if they have a history of hypertension in the past, if they have a family history of diabetes. These patients are very prone to diabetes and they have to go for diabetes checkup very regularly. In female, if there is a history of pregnancy induced diabetes in past, definitely she has to go for diabetes checkup every few years.
What are the causes that lead to diabetes in different age groups?
Well, there are two types of diabetes. One is type 1 and another is type 2. Type 1 diabetes is usually seen in less than 30 years of age, and type 2 diabetes it is usually seen in more than 30 years of age. And causes wise, in type 1 diabetes there are multiple factors, especially immunological factors, environmental factors and genetic factors, where exactly there is a complete destruction of beta cells which is leading to absence of insulin, and for that patient has to take insulin throughout his life. In type 2 diabetes, there are again environmental factor is usually a lifestyle disease, where sometimes genetic factor is also coming into play, where exactly there is a progressive destruction of beta cells from where the insulin is producing.
Doctor, to what extent does diabetes affect my immune system?
Yeah, diabetes definitely affects your immune system, and which is making you very prone to certain infections like urinary tract infections, foot infections, fungal infections, and various other infections. Yeah.
Also, tell me how telemedicines can be put to good use for the treatment of chronic diseases among patients like those suffering from diabetes.
Okay. Telemedicine is really a help for chronic diabetic patients, because those who are having chronic diabetes, they have to monitor their reports as well as their condition very frequently, and it is very difficult for them to go to doctors very frequently and to visit the hospital or clinic. So in that case, telemedicine definitely it works. They can communicate with the doctors and they can send their reports on their mobile phone, and this is very easy communication for both of them, and that is how they save their time and money also.
iOnline Doctor posts new health videos on Wednesdays and Fridays. Subscribe now and press the bell icon to never miss an update.